Hi, this is Dr. Drew Collins. We're talking about Thymosin B4 Frag. So this is one of the peptides that's the hottest, used as a binary stack with BPC157. Usually these are done subcutaneously, but I'm interested in the fact that you can get a hold of this TB4 Frag orally from a compound pharmacist, and we can help you with that if you're interested in giving our office a call. But 858-333-5196 is my office proactive choice. So Dr. Collins likes peptides, and this is one of the better ones. So Thymosin Beta-4 Fragment is, again, smaller little end pieces of a bigger amino acid that comes from the thymus gland. So thymus gland traditionally is the immune identifier that tells your white blood cells what to do, particularly the thymus or T cell, educated forms of white blood cells. So what this stuff is gaining attention about, and again, it's usually done subcutaneously a couple times a week, but not that much amounts, like 2 milligram shots. Anti-inflammatory, so tissue necrosing factor alpha, interleukin-1 beta, interleukin 6, and NFK beta, a very famous inflammatory potentiator. All those are inhibited by this pesky little amino acid combo peptide. And so anti-inflammatory is awesome, but it is known for some specific physical pathologies. Dry eye is a big one. So dry eye has some great clinical trials with it, and people can do it even in form of eye drops, when the custom compound pharmacists can make it into eye drops. So think about dry eye. It affects a lot of people as they get older, about 1.5 micrograms a day, but check with your ophthalmologist about that. Your compounding ophthalmologist. I hope you have one. You all should. Cardiac repair, my favorite subject, and even wound healing, skin healing. So this compound helps tell the epithelial cells, but also the fibroblasts and all the other types of wound-related cells to migrate to the area. So sometimes the body's sort of frozen and won't remember how to get stuff where it needs to go to fix a decubitus ulcer or some sort of bent sore or that kind of thing, long-standing open wound. This stuff directs the cells to go there and start patching things up. So that's really a boon to hospital patients and people with blood sugar issues where they can't seem to get a handle on wound care, wound repair. There's an overall generic sense that this is facilitating all tissues, particularly at the mitochondrial level, to not give up the ghost, as they say, and everyone talks about apoptosis. So this tissue influencing compound tells the cells not to give in to mitochondrial damage and to support themselves and keep on going, keep on trucking. So the mitochondria don't give up and they don't create an apoptotic event for that cell. So it keeps the cell alive by keeping the reactive oxygen species generating in the mitochondria. So that's a generic thing all across all cells, not just the immune regulatory white blood cells, but all cells are helped to not have this early cell death because of mitochondrial dysfunction. So it works on mitochondria, turns out. So we've got the idea that autoimmune diseases are everywhere, and people link that, I think, to leaky gut and tight junction failure in the intestinal lining, that kind of thing. So what we've got is, besides in general tissue not being as sloughed off or inflammatory or chronically inflamed, but we also have the immune system being ordered and told to go where it should go and migrate to that kind of area and get the job done, but also not to do excessive scarring. So we think about scarring like a cut on our skin, but there's also scarring the liver and scarring in some of the larger organs and even heart tissue. So Thymosin Beta-4 Frag, as this peptide is called, is great for not having excess scarring. So scarring, not just in a dermal wound, but in large organ fibrosis. So we get rid of a lot of the cytokine storms with this product, and we also get rid of the classic inflammatory markers and interleukins and that sort of thing. So low on the inflammation with this stuff, and pro on the cells, remodeling, regenerating. There's information, but particularly on tendons and tendons repairing with more tensile strength. So it's not just sticking stuff back together, but it's getting it to go back together correctly under a load. So tendons repairing themselves 50% better under the TB4 Frag influence. Okay, come back in a little bit for another part 3 on this whole TB4 Frag. Bye. Dr. Collins signing out for now.